What if your daily routine was interrupted by pain, stiffness, and fatigue? What if every step you took felt like walking on glass? Rheumatoid arthritis is more than just aches and pains. It's a chronic condition that can change your life. In this video, we're diving deep into the symptoms of rheumatoid arthritis, how they manifest, the warning signs to watch out for, and what your body is trying to tell you. Stay tuned to learn how this condition affects not just your joints but your entire body. You don't want to miss this. Rheumatoid joint pain, frequently truncated as RA, is an immune system illness. This implies your invulnerable framework, the body's guard system, erroneously goes after sound tissue, basically influencing your joints. Yet, did you realize RA can influence something other than your joints? It can focus on your whole body, leaving you feeling depleted, exhausted, and in any event, causing fever. We should investigate the most widely recognized and amazing side effects of this condition. Joint symptoms, the first signs. It all starts in your joints. This is where RA first shows its face. Pain and tenderness. Torment is one of the earliest and most telling indications of RA. Yet, it's not your average post-exercise irritation. This aggravation can feel profound and steady, particularly after times of rest. Envision getting up in the first part of the day, and your hands feel like they've been in a bad habit hold the entire night long. Think this sounds like normal joint pain? Think again. Stick around to find out why this pain is different from anything you felt before. Swelling and inflammation. Swelling in the joints is another hallmark symptom of RA. The inflammation causes fluid to build up around the joints, making them feel puffy and sometimes hot to the touch. And this isn't just in one joint. RA is symmetrical. It affects both sides of the body. So, if your left wrist is aching, chances are your right wrist will feel it too. Morning stiffness. Another early sign is morning firmness. Assuming that you awaken and feel like your joints are secured, you might be encountering RA. What's more, we're not discussing a little firmness that disappears after a couple extends. RA solidness can keep going for a really long time, causing even the littlest undertakings to feel unthinkable. Is your stiffness lasting longer than normal? Don't brush it off as just getting older. Find out what this means. Systemic symptoms. Beyond the joints, rheumatoid arthritis is deceptive. It doesn't just attack your joints, it impacts your entire body. Here's where it gets tricky. Fatigue. Weakness is one of the most disregarded side effects of RA. It's that sensation of being continually worn out, regardless of how much rest you get. This is on the grounds that your invulnerable framework is staying at work past 40 hours, going after your body from the inside. Fever. And yes, fever. You wouldn't normally associate fever with a joint disorder, but RA can cause low-grade fevers during flare-ups. These are warning signs that your body is under attack. The other surprising symptoms, you might think rheumatoid arthritis stops at pain and fatigue, but there's more. Here are a few symptoms that may surprise you. Rheumatoid nodules. Have you at any point saw little, firm bumps framing under the skin around your joints? These are known as rheumatoid knobs. They can be basically as little as a pea or bigger, and they're one of the more noticeable side effects of RA. Eye, skin, and lung issues. Rheumatoid joint inflammation can likewise bring on some issues past the joints, similar to eye aggravation and dryness. In any case, it doesn't stop there. RA can prompt lung issues like pleuritis, which is irritation of the lung lining. Shocked? We're just getting started. RA's impact on the body is far-reaching. Stick around to learn how this disease affects mobility and daily life. Impact on mobility and daily life. Living with RA doesn't just mean dealing with joint pain. It can fundamentally change the way you move, work, and live your day-to-day life. Decreased range of motion. As RA advances, it can restrict your scope of movement. Regular exercises, like opening containers, climbing steps, or in any event, strolling, become testing. This deficiency of versatility isn't simply physical, it incurs significant damage as well. Emotional and mental health effects. Chronic illness like RA doesn't just attack the body, it can have a profound effect on mental and emotional well-being. Depression and anxiety. Many individuals with RA experience discouragement and nervousness. The consistent aggravation, the capriciousness of eruptions, and the impediments on day-to-day existence can prompt sensations of sadness. Psychological wellness support is similarly basically as significant as clinical treatment for RA. Why early detection is key. Things being what they are, the reason doesn't matter in the event that you get RA early, since early recognition and treatment can dial back the infection, forestalling irreversible joint harm and working on personal satisfaction. If any of these symptoms sound familiar, don't wait. Talk to a healthcare provider and take action now. How rheumatoid arthritis is diagnosed. If you suspect RA, how do doctors confirm it? Conclusion begins with an exhaustive actual test, yet specialists likewise use blood tests to check for irritation markers, as rheumatoid variable and hostile to CCP antibodies. Imaging tests, like X-beams or X-rays, can uncover joint harm or irritation. What occurs next after finding? Remain tuned as we investigate treatment choices and how to live with RA. Living with rheumatoid arthritis. Treatment options. Living with RA is difficult. Yet, with the right treatment, many individuals have full, dynamic existences. Treatment normally includes a mix of prescriptions, hostile to inflammatories, sickness-changing medications, and biologics that work to slow the movement of the illness and oversee torment. Exercise, diet, and lifestyle adjustments. Notwithstanding prescription, way of life changes can improve things significantly. Low-influence works out, such as swimming or yoga, can assist with keeping up with joint capability, while a solid, mitigating diet upholds your resistant framework. Living with RA is an excursion, however, with the right devices, backing, and mentality, you can recover your life. RA might be a long-lasting condition, however, it doesn't characterize you. Whether you're living with the sickness or simply starting to perceive the side effects, information is power. Be proactive, look for treatment early, and make every moment count.